right, how many degrees are we at right now?
We're at negative 160, so we're fixing to hit the negative 180 mark, and that's where the cryotherapy begins. Here's the cryo session. We want 90 seconds in this range, and that's enough to trigger this response from your body.
Texas. We're about to try cryotherapy for the first time. We're going to let you know how it goes. So here we go. You hear about it with athletes like LeBron James and Steph Curry. And as a spine surgeon, the ergonomics are really not that good. We spend a lot of hours and a lot of time bending over, doing surgery for 8 to 9 hours. And after surgery, sometimes my neck hurts or my lower back hurts. So we're going to try cryotherapy for the first time today and see how it is. Also, for the opioid crisis that's out there, I want to, as a physician, offer my patients non-pharmacological treatment options that they can do and try for their pain to maybe decrease the chance of going to surgery. So we're going to try it out here soon. So before you do cryotherapy, you have to fill out a questionnaire. It essentially asks you, do you have any medical conditions like hypertension, peripheral vascular disease, have you had a heart attack before, any infections of your skin, pacemakers, defibrillators. It's a relatively safe session, but you want to make sure that you don't have any of the contraindications that we talked about. So, all right, so I'm here with Dave at Cryo Boost. Tell us about cryotherapy. What is it?
Yeah, so whole body cryotherapy was invented in the late 70s, 1970s, in Japan. A doctor wanted to try to figure out a way to treat arthritic inflammation without drugs. And so he designed a way to flash cool the skin, just the outer layer of skin, to about 40 degrees. That triggers your body's response like a placebo effect. The body's healing systems get activated at that cold temperature when the whole system is exposed to cold temperature. And so your body activates those healing systems in preparation of something negative happening to the skin surface. Cryo is only 2 to 3 minutes. If I left you in there for 6 or 7 minutes, you'd have burns over most of your skin surface. Your body, in anticipation of that, triggers those healing systems and goes out and sends resources and tricks the body to sending resources to other areas, like the arthritic inflammation. Arthritic inflammation is autoimmune, so your body doesn't treat that kind of inflammation because it's creating it, but we can trick the body into targeting that inflammation. But we can trick the body into targeting any kind of inflammation in the body. Muscle recovery, injuries, post-op. So it's just a way to kind of accelerate healing in the body in a natural way.
Gotcha. And it's, in orthopedics is one of the things we're always trying to fight inflammation and swelling. And we actually use cold therapy in patients who have knee replacements and hip replacements. We'll place it kind of local cryotherapy. This is considered whole body.
Yeah, and it's really, a lot of people come in and think this is a super ice bath or a super ice pack. But really, the cold therapy is doing something different in what you're using as. The cold packs move blood out of that area, promote circulation. The cryo, on the other hand, because it's the full body being affected, it creates a different level, a different reaction from the body. The body thinks it's fallen in a frozen lake or some sort of very negative scenario. And so it has to perform this big, boost to the system to preserve life, essentially. But we can do that and trick the body without causing any negative repercussions. But the body activates those healing systems and goes out and targets and heals. It's, it's like the placebo effect. It's like a cold sugar pill is what I tell people. The sugar pill has been shown to trigger a healing response in your body. We can target it with a cold by exposing most of the system. If we just put our arm in here, because we had a wrist injury and tried to get some sort of full body cryo, it wouldn't happen. It would just move some blood out of that area. But when the whole system's exposed, that's when the body goes in this extra gear. The body's really in tune with temperature change. And you've heard of people falling in a frozen lake, surviving 20 minutes submersed. The body's very in tune, so knows what to do in these situations.
Yeah, and there have been several studies that come out in the rheumatology literature as well as oncology in terms of patients with undergoing chemotherapy and helping with the neuropathy and decreasing the inflammatory mediators and rheumatoid arthritis. So really looking forward to trying it.
Yeah, I'm excited.
Who should and should not get cryotherapy? What are some contraindications?
So cryotherapy is considered a normal activity. But for certain people with certain conditions, especially more high-risk patients of other things, you know, a person with a pacemaker, a defibrillator, a diabetic that doesn't have his diabetes under control, that person, we want to get approval from their doctor, make sure that they're approved for normal activity before entering the cryosauna. But in general, cryotherapy is safe for all ages, and we have to be careful about anybody that's a high risk of other health factors. You know, so that's why we want to make sure that their body's prepared for this environment, and that, you know, something down the road doesn't occur with their condition that they place blame on the whole body cryotherapy for possibly triggering something. You know, a diabetic that doesn't have diabetes under control does cryo, a month later is diagnosed and has to have his foot removed. Would not, you know, that just doesn't mix well with what we're doing here. We want to make sure a person is in relatively good health, you know, as a system. They can have injuries, you know, post-op, you know, sprains, pulls. Also people with pulmonary embolisms or blood clots. That's very dangerous in cryo because we're moving a lot of blood in this situation, so we got to be careful. Usually after surgeries, we want to wait a few days to make sure they're out of the woods on those kind of conditions occurring.
Okay, so I'm really looking forward to it. I'm actually a little sore from operating over the past week. My neck and spine surgery, we bend down and we look in these small holes, and my neck is like this for sometimes 6 to 8 hours. So after surgery, my neck is usually sore, my back is usually sore, my legs. When we're doing a hip replacement or a knee replacement, we're using mallets and drills and screws, and I'm really sore at the end of the day, especially if we do a number of them. So looking forward to it. I'm a little nervous.
Yeah, that's totally normal. I tell people, I want you to be nervous. It's an exciting experience your first time. You'll never forget your first time doing cryotherapy.
Awesome. All right, looking forward to it. So now we're about to get my blood pressure checked and hopefully get into the chamber here next.
Here we go. All right, we'll start you up here. You got the sock slippers, gloves on?
Yes.
Okay, good. I always like to double check here. So I want you really focusing on breathing. And for you especially, because you already have some neck tension, some neck issues, we want to try to stay relaxed with the neck and the shoulders. So a little bit of wobble in the shoulders. Deep breath. Give me a deep nose breath, deep belly breath. And out. And then turn back this way. No, it's a different kind of cold. Now give me a nose breath. There you go. Release those shoulders. There you go. Good job. Good job. The normal reaction in cold environments is squeeze and tighten up.
Yeah.
That's going to be against what we're trying to look for here. Give me a little rotation here towards the wall. Kind of shuffle this way. You can feel the cold air coming in that back side here, so we want to rotate you. Yeah, it gets pretty intense here pretty quick. There you go. Like that cold. Box it. Box it. Tight. There you go. Keep those shoulders. Yeah, keep them moving. Keep them moving. There you go. Turn back this way for me. You got it.
My legs hurt more than anything.
Yeah, the cold air drops in there, so that's the reason we have to have those far in there as possible. But don't worry, that top part's going to be targeted. Even your hands and your feet that are covered are still targeted from this response. Turn back this way for me. 30 seconds left. Deep nose breath. Deep belly breath. There you go. Good, good, good. 20 seconds. Home stretch here. You got it. It kind of gets numb towards the end, so it kind of escalates and then plateaus, and you kind of cruise towards the end here. All right, 10 seconds. You did it. He's a fighter. He's a fighter. Good job. All All right, good job,
Not
champ.
bad at all.
Yeah, hit that.
Woo!
Good, all right, we're gonna step out and just watch that step come out. You can hang on to the side step.
All right, so we just got done with our session. Actually, it wasn't too bad. The worst part was actually the tingling in my legs, but not like painful or whatever. And I actually feel pretty good. My back feels really good, more flexibility than I had. My neck feels pretty good, so yeah.
Yeah, so like you're saying, the post-cryotherapy protocols are to do that stretching, mobility. If you're seeing a physical therapist, any exercise they're giving you or chiropractors are giving you, it's really good to go, if you seek chiropractic care, to go to your chiropractor immediately afterwards. So you have that mobility, he's able to do the adjustment, and the adjustment's able to stick for longer, essentially. Because the muscles are usually what pulls your spine and bones out of place. We can relax those muscles. That's why they do a lot of massage and TENS units to try to relax those muscles. This is another level that's going to be helpful and encouraging. So a lot of people come in after physical therapy as well, to recover from that. But yeah, this is the time to do any stretching, movements, yoga. We had a bunch of NFL guys in over the summer, and they were all doing yoga out there.
Yeah,
Big dudes,
nice.
Bigger than you. So yeah, well, I'm glad you came and checked it out.
Yeah, absolutely. Where can people find out about your business, and how can they come in and get seen?
Yeah, so cryoboost.com, CRYOBOST. Check out our Facebook, check out our Instagram. Give us a call, 469-534-7824. But just in general, I know your reach is really far. You want to check out your whole body cryotherapy, close to you. You saw a session now, so it's going to be real helpful because you want to be real careful and make sure that they're doing the same things that we did here. There are some, just like in any industry, there's some chiropractors and cryotherapy places that do things well, and some that, get a little relaxed in the procedures. But make sure you have the socks, slippers, gloves, and no moisture, and then you'll be good.
All right, thank you so much,
All
Dave.
right.